Autoimmune is when your immune system actually mistakes your body as the enemy. And instead of protecting you, it starts attacking you. It came in my mouth first, so I went to the dentist. Dentist said, oh, just cut out meat, I'll become okay. I said, okay, so it became better. Then it went to my throat. So then I went, someone said, get your tonsils removed. Then it kind of came on my body. Someone thought it was hemorrhoid. So every doctor was looking at it in isolation, and I think that was the biggest problem, that no one really knew what it really was.
It looks like a guess game. Like everybody's like taking a guess. Maybe
Everyone,
ये
yeah,
होगा.
exactly.
Okay.
So I remember I came to you and you just said this one line that I'll remember forever, which kind of like changed my perception. And you were like, Sahar, I don't care if you gain weight, lose weight, whatever it might be, but this is an investment into your future, because as you grow older, especially even with you, you lose muscle mass, right? And you might not be able to walk. So this is an investment into your future. And I was like, I'm sold, I'm done. So
I didn't know that. I didn't even remember that I told you this. अगर आप ऑटो इम्यून डिजीज से स्ट्रगल कर रहे हैं या आपके आसपास कोई भी है जो ऑटो इम्यून डिजीज से स्ट्रगल कर रहा है, सो दिस इज़ द पॉडकास्ट फॉर यू. इस पॉडकास्ट में हम लोगों ने डिस्कस किया है कि ऑटो इम्यून डिजीज़ क्या है, उसके क्या क्या सिम्टम्स हो सकते हैं और उसकी रिकवरी किस तरीके से हो सकती है. ये पूरा पॉडकास्ट इंग्लिश के अंदर है, सो आई होप यू विल एंजॉय द एपिसोड एंड गेट समथिंग आउट ऑफ इट. हाय सहर,
hello.
हाउ आर यू डूइंग?
Good, alhamdulillah.
आई एम एक्चुअली वेरी एक्साइटेड फॉर दिस पॉडकास्ट. रीज़न बीन, एक तो ये नेसेसरी भी है बिकॉज वी आर टॉकिंग अबाउट ऑटो इम्यून डिजीज़. इसके बारे में मैंने थोड़ा बहुत पढ़ा है, बट मुझे इतना ज़्यादा इन्फॉर्मेशन है नहीं मेरे पास. एंड आई नो सो मैनी पीपल हु हैव इट एंड दे ऑलवेज स्ट्रगल विद इट. So, do you want to tell me what is autoimmune disease and when you actually had it the first time?
So, I mean, thank you for having me, because I do think there's not enough information out there, especially in Pakistan. Autoimmune is when your immune system actually mistakes your body as the enemy. And instead of protecting you, it starts attacking you. Right? That's really the definition of an autoimmune. Now, everyone thinks, even I thought that, कि autoimmune सबको एक ही होती है, but there are like hundreds and thousands of different autoimmunes, like there's lupus, there's pemphigus, which I have, there are thousands. Diabetes type 1 is also autoimmune. So autoimmune is essentially that thing that even doctors everywhere in the world, they don't know why it happens, so they don't have a cure for it.
Okay.
So that's really what it is.
So immune system का mainly जो काम होता है, तो if the people don't know, is to attack the unhealthy cell or unhealthy, just like a viral that you have, any kind of infection that you have. तो immune system का काम है to attack those things. But in autoimmune disease, it also attacks the healthy cells of your body,
So
which
it starts
is not
attacking.
supposed to happen.
It's
so
an
this kind of like
overactive
dysfunction of your immune system.
Exactly.
So that's called autoimmune disease. So when was the first time you got diagnosed with autoimmune disease?
So I got diagnosed much later. I think I got diagnosed in 2017. But since 2015, I think even 2014, I had started feeling very lazy. And that's not me at all. Like since school, I've been very athletic, very sporty, but now I would come back from work and I would need to take a nap, and even like my parents were like, what's wrong with you? You're always lying around, And I didn't know what was wrong with me. And I started falling sick a lot, and I started getting anxiety. And at that time, we didn't know much about mental health either, like anxiety was not spoken about or anything at all like that. Anyway, so I think my autoimmune manifested in a skin disorder as well. But what happened with that first was it came in my mouth first. So I went to the dentist. Dentist said, oh, just cut out meat, I'll become okay. I said, okay, so it became better. Then it went to my throat. So then I went, someone said, get your tonsils removed. Then it kind of came on my body. Someone thought it was hemorrhoid. So every doctor was looking at it in isolation. And I think that was the biggest problem, that no one really knew what it really was,
It looks like a guess game. Like everybody's like taking a guess. Maybe
everyone, exactly. When it started coming out on my chest and my back, that's when I was actually also speaking to like a consultant in the US, and I was like, what is this? Because I would get these blisters and they wouldn't heal. So I get blisters all over my body and they don't heal. So they're like open wounds. And they would start healing, like, jo crust aa jata hai, and then they would open up again,
Okay.
So the consultant over there said, look, I think it's pemphigus and you need to go see a dermatologist now as well, So I went to a dermatologist, and finally she diagnosed it, but she just diagnosed it by looking at it. She did not tell me to do any tests, which is what you're supposed to do. Now, I mean, there are no exact tests for autoimmune. They're a mixture of tests, like, you'll have to see your blood count, the inflammatory markers, all of those things together, and then obviously the symptoms that you're going through, and then the doctors make an educated guess. For stuff on the body, they can even do biopsies and all of that, but this dermatologist looked at it and said, oh, you have pemphigus, and do you mind if I take a picture, because I haven't ever seen live lesions, and I would like to show my students that. So here I was, not knowing what pemphigus is, not even really knowing what an autoimmune is, just thinking for 7-8 months that there's something wrong. I don't know what's wrong with me. So there's lots to be said about the bedside manners of that doctor. But once I got diagnosed, she put me on treatment for steroids as well. But Parvez, those 7-8 months, were horrible, because I thought I was going crazy. I was like, I know there's something wrong, and I can't put my finger on it. I don't know what's happening to me.
That was before you got diagnosed, or that was after you got
That was
diagnosed?
before I got
Before.
diagnosed,
Okay.
yeah.
So do you see as a doctors not doing justification of their occupation?
I think so, but I think also, I think there's been a big change after 2020. I think autoimmune diseases are more common. They're more spoken about now. Like, I know so many people who have Hashimoto as well. I know quite a few who have lupus. And, I think
Even arthritis is a type of autoimmune disease.
rheumatoid
actually. Yeah.
arthritis, yes, RA. So there is so many now autoimmune diseases. I hate to call it a disease, really, but yeah. So, and people are speaking more about it. There's more awareness about it. I think even through social media, there's more awareness about it. There are more doctors that are talking about it. There are more doctors that are treating it as well. So I think because of that, there is more awareness, but lots more can be done, because I feel like people, especially over here, you go to a doctor and you're like, I'm not feeling like myself. And they're like, oh, anxiety, okay. And then they give you like a pill, like a Lexotanol or something. And they're like, bas ye aap kha le and everything will become okay. And
that doesn't sound right to me, actually. Maybe short term it might work.
Yeah.
Okay, आपने anxiety ले ली and you feel better.
Yeah.
But अगर there's an autoimmune disease, you're maybe feeling anxious because of it, but just taking care of your anxiety is not going to fix the autoimmune disease, right?
Not at all.
Not at
And
all.
I mean, they're not even going down to understanding ke kya hai. Maybe it's not and stress. I feel like even if it's stress triggers other diseases, right? Your body stores trauma, your body stores stress, and it manifests in diseases, it manifests in illnesses, right? So it's a doctor's duty to actually go down and understand, get the test done, ask for the history instead of just prescribing a sleeping pill.
So one question I have, because of the thing that we just discussed about the anxiety. Do we get autoimmune disease because of the anxiety and stress, or you got stressed and anxiety because of the autoimmune disease? What is the relation there?
I think it can be both. I think not knowing what you have is the biggest battle. Once you know what you have, then you take the meds or you do a lifestyle change and you can get better, right? The most anxiety comes in when you're like, I know there's something wrong with me, but I don't know what it is. Having said that, I believe autoimmune is caused by stress and also trauma. I'm a big believer in your body storing all of that. In fact, like, I follow this guy, Kabir Mate. He's a really good professor as well. And I've even looked at it, and he said, the people who are most likely to get autoimmunes are one of those who are the very nice people, the people pleasers, right? Because they don't have their boundaries and they keep saying yes to everything, and they put their needs before anyone else's needs, right? So they're always stuck. And when they do that, they get more stressed out, they take a lot of more stress. So, that's also, like, I feel like drawing your own boundaries, being very selfish with your time, knowing what's good for you. Those are very important things that I've learned now, actually. So, but going back to where I was talking about when I got diagnosed, so I was put on steroids. Without really being given information. I was given no information. In fact, when I got diagnosed with pemphigus vulgaris. Like I said, it's blisters all over the body, and it's 1 in 3 million, so it's very rare, which is why she wanted to take a picture as well. But when I asked her what it is, she literally said, Google it.
Okay.
So now, the problem with Google is that if you Google anything, everything leads to death almost, So I'm like,
Of
oh my
course.
God, I'm going to die. I'm going to die. And at that time, actually, because my pemphigus had spread so much, I had a very, very high chance of actually not being able to overcome this. In fact, it was about 70%. So she put me on a very, very high dosage of steroids, and every day and I'd never really taken such intense medicines, right? Without being given any information. Every day I would wake up with a new sort of side effect, if I would sleep at all, because steroids gives you insomnia, like severe insomnia. So I would sleep for 2 hours a day, if at all, So I was going berserk as well. Then I started putting on a lot of weight. I started bloating, It started from my
That was
face,
because of the steroid that you're
all
taking.
because of my
Okay.
and then my stomach started coming out, and I used to be quite a small, like I was never fat because I was always athletic, and then I got yeast infections. Um, I became so big at one point, my knees couldn't take it. So there were days I couldn't walk because I'd never been, that big. And, when you're tapering down from steroids, then you have the emotional side of it, because steroids in some ways kind of makes you happy, I think it does something for your hormones as well. And then when you're tapering down, you become depressed and sad, so I would cry over like the stupidest things. I remember I'd be at work as well, and there'd be tears coming out, and my team would be like, what's wrong, Sahar? And I'm like, just ignore me, I don't even know why I'm crying. So it was quite like a hellish experience to be on steroids, and in the beginning no one understood it, because I would wake up and I'd be, I'd try to make plans with my friends and whatnot. But by evening, my side effect became so bad that I was like, no, I'm not, I can't come out. And a lot of my friends were like, oh, she's become so flaky. But I don't think people understand what you're going through till it doesn't show on your body. Or, when I started putting on the weight, then they're like, oh, I see what you're going through.
Okay. Tell me something. So there's one physical aspect of it. Okay, you have blisters on your body, and it's very painful. So there's a physical pain there.
Yeah.
But right now you mentioned something that gaining weight, steroids, emotional
Yeah.
roller coaster was there. So before you got diagnosed, you spent 3 years without knowing, okay, what is going on.
Yeah.
After knowing, you have a treatment that costs a lot of different things. Throughout those time, this is looks like a 5-6 years of period.
Yeah.
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 What bothers you more? Is this more emotional side of it, or is it more physical side of it?
I think a little bit of both. You see, I mean, my body changed overnight, right? So it wasn't that I went out, had a good time, ate lots of food that I loved, and that's how I gained the weight. I gained it because I was on medication and it was very tough. But alhamdulillah, I'm still alive, so I'm glad for that. And because I've changed it all around, it's good. But it takes a toll, right? Like when you look at yourself in the mirror, you don't recognize yourself. You don't even know how to dress. I didn't know how to dress being that big, actually, because I've never had to, right? I always wear T-shirts and tights and all of that, and suddenly I had to kind of change that around. My hair has always kind of been straight. Suddenly it became very frizzy. I didn't even know how to do that. But that's obviously the physical aspect of it, but that also takes a toll mentally, right? Like sometimes I would go out and people who did not know, and at that time it was just like on my face and I was gaining a bit, and they were like, backed a few pounds, haven't you, Sahar? So, I mean, that takes a toll on you. But the mental aspect as well, because it's very lonely. Like I said, people don't know what you're going through until they don't see it as well. Or also, I guess at that time, people didn't even know about autoimmune. Now they have more of an understanding, right? And especially when I started talking about it, they got it as well. So a lot of my friends, I have to say, like some of them, I lost a lot of friends as well. But the ones I gained and the ones I kept, like those are my friends for life. They would talk to me. One of my friends would talk to me for 5 hours every night, because I had insomnia, but she would try to make me feel better and just do buck for 5 hours at night. There were two friends of mine. I didn't go out for actually 5 months. I didn't step out of my house. I would just go to work and come back, because I didn't want to go out and explain the story to everyone, because everyone would get shocked by looking at me. So two of my friends came over and they just started forcing me to get out. And so those kind of friends, I mean, that was amazing, because now the friends that I have, I know those are the friends I want to keep for life, and have been there for me.
But why you lost friends? Like for what reasons? Just because you're not going out or something? What was that?
Yeah, that happens. There are a few social friends. We all have them, and
Okay.
but it's good to know as well, right? Like now that I have those friends, and I know those are the good time friends. But these are the friends I get to keep. So
Yeah.
you also invest accordingly. Yeah,
Yeah, I understand that. Okay,
yeah.
so now we are talking about the treatment part, right? So you had your steroids. Did it fix everything,
I think
or was it like
steroids.
ongoing thing?
Steroids. So I took a course because it was a very high dosage. It was 80 mg and it was all oral. So every day I was taking like 30, 40 tablets because even with steroids, first you have to line your stomach and then you take immunosuppressant medicines as well. So I don't know how many medicines I was taking a day. And then I started tapering down. So it was a whole course about 6 to 8 months. And it was hell. And when I was done with the course, a month later, I relapsed. And I remember telling my mother, I said, Mama, and I would never say that, like, but it was such a bad experience that I was like, I'd rather die than go through this again. I just could not. I did not have the willpower to do it all over again. So we started searching for other options, and we came across this infusion, which is called rituximab. So rituximab is more common with RA, the rheumatoid arthritis, also very common with lupus, but also very good for pemphigus as well. They also use it in chemo patients. It's obviously not as intense, but that infusion is an infusion that you get for about 8 hours through an IV. And you're on the high dependency unit because you could have a reaction, so you have to be at the hospital. But that, after the steroids, was like a walk in the park because there were really no side effects. Literally none. I went to work after 2 days and I was happy, and that was just a game changer for me. But like with every medicine, I've always believed that that's not the cure. That's only fixing it for the time being, right? So it's not the cure. So when I got my rituximab infusion after 2 years, like clockwork, I got my pemphigus relapse again, went for the infusion. Then I got it again after 2 years, went for my infusion. And then I was thinking to myself, I said, you know what, Sahar, like there's so many medicines being pumped into my body that abhi to pata nahi chalega, but when I'm 60, 70, khuda hasta, or maybe even 50, and if I get really sick, a lot of the medicines won't work on me because my body has already gone through so much medication. And that's what medicines do, actually. It's really in the long term that you get to know the effects of it. So I said, I have to do something. I have to change my lifestyle. I have to. And because I'd become big, and because of this illness, it's almost like I started pitying myself as well. I said, okay, you know what? It's okay if I'm like this. Ab ho gaya na, main bimar thi, so why should I change it? But after the second infusion, that's where I started reading a lot of self-help books as well. And also, I think with COVID, what happened was that there became a lot of awareness. I started speaking about anxiety. I started speaking about the stress. I started speaking about what I went through as well. And I felt like I had a responsibility to change my own life for myself because I didn't want to be that person any longer. I wanted to look good again, but I also wanted to feel good again. I wanted to be happy again because even though I was going through those infusions, I wasn't really happy, with how I was feeling or how I looked as well. So
Yeah, but you mentioned there's another infusion that you did which was much better than the steroids, right?
yeah.
But was this option given to you by a doctor, or it was like just your own research that you found out?
This is my own research.
And then why it was not, the option is not given to you?
I don't know really because maybe in dermatology here they don't look at that I don't know actually, but it should have been given because I joined Facebook groups with pemphigus, so I was getting information from all over the world.
So do you think it's a lack of education? That is, people don't know much, especially doctor don't know much about it because you diagnosed after 3 years of the first occurrence of your disease, and then even after that, that medication that was given to you, steroids, which caused a lot of harm to you.
Yeah.
And then with your own research, you found out, okay, there is another thing that you can do.
Yeah.
That IV infusion that you do, which was way better than steroids.
Yeah.
So don't you think that's a lot of problem in the practice in the medical field?
Absolutely. I mean, I think especially with autoimmunes and the kind of that they are, right? Like, I wouldn't know what I have, but someone has to, and it's not as you know, it's not one of those common illnesses as well, right? So maybe people are going to say, oh, well, you should have gone to the right doctor. But how am I supposed to know? Like, either my GP should guide me, or I don't know who, but someone should guide me and tell me what's happening. Or if I'm going, I mean, I went to every doctor and I know all of them, including homeopathic ones as well now. So I've actually been to all of them.
Even I was reading about this disease before our podcast,
Yeah.
and I found out like even IBS is also a part of autoimmune disease.
Yeah.
IBD, they call it
Yes.
IBD, IBS, as where it is an inflammatory bowel disease. It is also a part of autoimmune disease. I didn't know that actually.
Actually, even I didn't know that. I thought it was just.
Yeah. So it is also a part of autoimmune disease where it's like it's attacking your gut.
Yeah.
Basically,
Yeah.
your immunity, and which is now again, if it is a part of autoimmune disease, I'm sure many people I know have this, but they
Yeah.
don't know it is autoimmune disease.
Exactly. Yeah.
So I think I don't know, like it is a lot to like if I keep criticizing the doctors, but the thing is like education part is definitely is not there about this disease for
No.
sure.
Yeah.
So how do we so I and even you can't really say okay, do this test so you know.
No.
Okay, you have autoimmune
Exactly,
disease.
yeah.
You have to go with the symptoms.
Yeah.
कि अगर ये XYZ symptoms है तो this is possibly the autoimmune disease.
And actually, you know, Parvez, what happens over here is, I heard this a lot. Everyone like, no, तुम तो पागल हो, तुम बहुत सोच रही हो. And I'm like, no, but I'm actually not feeling like myself. And like I said, until they don't see it outside on your body or something, they're like, no, you're crazy.
So you have it on your body, so visually you can see it, right?
That's much later. I think it started much before, you know, when I didn't have energy, I was feeling low, I didn't want to get up. I think that in itself had started at that point.
Yeah, but some people who have a Hashimoto's, you can't see it
Yeah.
on your body.
No.
The arthritis, you can't see it on your body. Type
Yeah.
1 diabetes, you can't see it on your body. IBD, you can't see it on your body.
Yeah.
तो अगर ये सारी चीज़ें जो आप देख भी नहीं सकते, and then somebody say like, yeah, I'm not feeling good, and the people around, even doctors not believing you.
Yeah.
They're like, आप सिर्फ ज़्यादा सोच रहे हो. Like how can people really work around it?
They can't.
कैसे believe दिलाऊं कि हाँ नहीं, I'm actually not feeling good. What do you think a person should do in that scenario? कि okay, physically तो कुछ नज़र नहीं आ रहा, but I'm not feeling myself.
So I think belief in yourself is number one, you know, and I think then you need to start sort of researching. I think there's a lot available on the web, but you also have to be a bit disciplined. Okay, don't go down the rabbit hole and think you're going to die, you know. But put your symptoms, because likelihood is if you're not feeling like yourself, if your energy is going down, you have some sort of autoimmune, I think, you know, or something's off. And you need to go with your symptoms. You need to start reaching out to people who've had autoimmune. And I think there are a lot of people talking now. I think the first thing I should have done, maybe when I got diagnosed with pemphigus, but I was so in my head at that time, going through steroids, I should have joined a pemphigus group, which I did on Facebook later. Because then you meet people from all over the world. You kind of find out what the newer medication is. You know, is this normal to feel? Because when it's so rare, 1 in 3 million, you don't meet a lot of people like that, right? So it helped me a lot to get to know people who are in the same boat as me, you know? So I think, unfortunately, in Pakistan, you kind of have to do your own research. If you can, talk to your cousins, or if you have, you know, doctors abroad, talk to them. They won't...
Somebody who can trust you as well.
Yeah.
Yeah. Okay, this person is saying he's not feeling good.
I think वहाँ तो actually they take it, because I think अब भी जो हो गया ना, like I said, I think mental health after COVID, उसकी अब बहुत importance देते हैं लोग, you know. I think people listen to you and they're like, I'm not feeling okay. They're now beginning to do that after COVID.
So do you think in 2014 when you first start feeling not well, उस टाइम पे अगर ये इन्फ्यूजन का पता होता है, उस टाइम पे अगर डायग्नोसिस हो जाता है, डू यू थिंक द ट्रीटमेंट कुड हैव बीन मच बेटर एंड राइट नाउ यू कुड हैव बीन इन अ मच बेटर स्टेट?
I think if agar 2014 में भी होता, I think at that time maybe I wouldn't even have needed treatment, because it had not manifested itself on my body. Like there were no blisters coming out. I was just feeling, and maybe I could have done some sort of lifestyle change at that point. You know what I mean? Even though, I mean, I was much younger, so I wasn't that sort of conscious about. I was still doing maybe one class, ऐसी कोई aerobics कर लेती थी या कुछ, or you know, in Ramzan play volleyball or something like that. But you know, kind of nutrition, all of those things I didn't really look into. Now, if you look at what all I do, it's insane. And people think I'm half crazy as well, in a good way, you know. Because in the morning, I have a tray, I have chia seeds soaked overnight, I have that water. I have hot water with lemon. Then I have another concoction with apple cider vinegar, ginger, garlic, carrot, and coriander. Then I have water with creatine, sorry. And then I have another water with collagen peptides. Then I dip my face in ice water. That's just the morning. Then throughout the day, I'll have Bee Gutsy water, the kefir water. Then I have CSC 1000. I have my supplements. I'm very good about my supplements. I have magnesium, zinc, omega 3, vitamin D, turmeric as well. So there's lots of things that I'm doing, you know. And on a daily basis, I know you don't believe me a lot of the times, but I try to eat healthy. And what I've recently started doing is, weekends I'm like, go out, have fun, go crazy if you want to. But on a day-to-day basis, I'm pretty healthy like that, you know. I try to actually not, this is a recent change. Now I'm not eating after dinner and like not even snacking. Even though I would snack on like vegetables and all of those things, but I just felt like, you know, I'm eating till literally I'm sleeping, so I need to give my body a rest, you know. But again, like I said, my journey of changing my lifestyle started with Muscle Matters. And I have to give it that, because my friend Khalil, I still remember, like, he was just like, what are you doing? Stop it now. And just come with me, talk to Parvez. If you don't feel it, you don't have to go. He was like, but stop this pity partying. You know, that, oh, I can't work out. My bones are weak. My bones will break. I literally was making all these excuses. So I remember I came to you and you just said this one line that I'll remember forever, which kind of like changed my perception. And you were like, Sahar, I don't care if you gain weight, lose weight, whatever it might be, but this is an investment into your future, because as you grow older, especially even with you lose muscle mass, right? And you might not be able to walk. So this is an investment into your future. And I was like, I'm sold, I'm done. So
I didn't know that. I didn't even remember that I told you this.
yeah, that's the line which I actually why I got convinced, you know, because it was very easy for me to also stay in that sort of mind frame and be like, I went through such a tough time, I don't need to do anything. I've done it all, you know. But that's why I started doing it. And I think with Muscle Matters, I was lucky that I came to Muscle Matters, because it was just the environment that I needed, you know. It wasn't ke classes ho rahi hain, you know, you have a personal trainer. It's very personal, actually. And the thing I liked about it was that if I would ask you a question, you always gave me an educated answer. And if you did not know, you said, I'll, you know, do research and I'll let you know. So you became my go-to for everything, you know. And that was such a sort of treat almost, because you don't find people like that. You know, you don't find trainers who know so much as well, who enjoy reading and doing that research as well, and knowing which muscle, what to eat, what to do. And, you know, so that's why I kind of, and my trust started to build more on Muscle Matters. So I started with thrice a week. I'm still doing thrice a week. And I started seeing my body change as well. Weight also went down, but I saw like myself becoming sort of, you know, leaner, and strength-wise as well. And I think I made up my mind. So you then said, oh, go, you know, do cardio now. And I said, okay, well, I'm not going to start walking. So I picked up tennis, and I'd never learned. And I like sports more than anything. But I feel like once I started doing all of this, sports started gravitating towards me, you know. So one thing led to another. Then one of my friends came and said, oh, you know, we play volley. And I said, oh, really? Not just in Ramzan? He's like, no, we play all year round. So I started playing volley as well. So now my weekdays are all like tennis, gym, yoga, volley, you know, and I love it. And apart from that as well, I look into mental health as well. So I'll be doing Reiki, I'll be doing sound baths, I'll be doing meditation. I'm always enrolled in some course or the other. And like I said, my friends make fun of me, but actually, if I could have my way, I would quit my job and just do all of this.
Like, this is very overwhelming for me. I didn't know, like, okay, your journey of healing started with Muscle Matters.
It did.
Yeah, I knew you mentioned me back then a little bit about your disease, and you just recovered from it. But I didn't know after that, when you joined Muscle Matter, you have come that far. So thank you for sharing this firstly.
No, thank you.
And iske alawa, right now, if you currently say what all you're doing, because that's a complete turnaround of your life.
Yeah.
Like, taking steroids, being on bed and disease. Now you're doing working out, eating healthy, playing sports, like enjoying your life.
And every minute of it, actually.
Yeah. So I want to know, okay, what all you are doing right now.
Oh gosh, I'm actually doing all of that that I
Okay,
told you.
but let's just say to take one by one. So from the morning till evening, the whole week, let's just say. So you wake up and you have that morning routine
I have the morning routine.
where you have your supplementation and your anti-inflammatory
Yeah.
drink, and you have and what else you do? What else you have?
I dip my face in ice water.
Okay. By the way, anybody who wants to know, when you have a ice cold water on your face, if you just splash it on your face, it really activates your nervous system and sympathetic nervous system to be exact, and it really wakes you up. So if you feel like very lazy in the morning, just splash a cold water on your face. Yeah, and next.
And it's really good for your skin. It keeps you young as well. So then I actually have a job which is near the airport. So I go from DHA to the airport and I do my work. I work for TCS and I'm heading TCS Sentiments Express for them. So I do all my work and I try to kind of get everything done and make it to the gym by 6 p.m. Mondays is a bit of a no. Mondays I don't do the gym, but sometimes I pull in a class. But Mondays I have tennis 7 to 8. Then I have volley 8 to 10. Tuesdays I have gym 6 to 7. Sometimes I do yoga 7 to 8. Wednesdays I have again tennis and volley. Thursday I have gym yoga. Friday I actually have nothing. And
That's your recovery, complete
that's
recovery.
And Saturday I have gym, Sunday I have volley, and in between all of this, I'm gonna schedule sound baths and Reiki, and I do meditation at night for like 10 minutes every night, but I'm always enrolled in some class or the other. So recently I did this meditation class. Well, not recent now, but mid-November. It was 1 month course, and it was this Gabriel guy who's on Insta, and I love what he does, and he's in Bali. So it was really nice to do it online because then you meet people from all over the world as well. And I'm hoping to do all these retreats as well.
Wow. So that's like a from struggling to even find out what's wrong with you to something you heal your. I don't say completely heal. This is something that you have to manage along the way, right?
Yeah.
Can you completely heal autoimmune disease? Is there a possibility?
So you never know. I don't know, you
You don't
know.
know,
But what
actually.
I can tell you is that alhamdulillah, and I don't want to jinx it, that this time I did have a relapse in August. And I got blisters, but this time they started healing themselves, you know, and I did not have to go for the infusions. So it took longer, and अभी भी एक दो कभी का निकलते हैं, मेरी inflammation भी हो जाती है, but I just feel like something's working. I can't put my finger on what exactly is working because I've done so many things as well. But I think everything put together, it is working, you know. And apart from that, you know, Pravez, I'm just happier. And like I said, my friends, everyone thinks I'm a little crazy. But it's just that I want to spend every minute doing something, you know, because it got taken away from me as well, right? So for 5 years, I didn't really do anything. And it's a slippery slope. It's very easy to go down that road and get into depression and all of that, you know. And I've come out of it. And I just want to enjoy my life. And enjoying doesn't mean, I mean, enjoying it by doing all of these things as well, you know. But at the same time, I make time for my family. I'm making time for my friends. I'm literally, alhamdulillah, being able to do it all, you know.
Yeah, that's actually very inspiring because there's so many people who go into a depression, who go into anxiety, who get some disease, and they never really completely come out of it.
Yeah.
They always keep a part of that, and they become a victim of it. You know,
Yeah.
that, and it's very common nowadays. Now coming out of it, and even just saying that I'm enjoying my life every minute of it, that's, I think it's a big achievement.
Yeah.
itself. Like, this is kind of like very inspiring. I didn't know actually. By the way, not many people know that Sahar has trained with me
Yeah.
for over a year now. She's training with one of my trainers at Muscle Matters. So yeah, this is like really inspiring for me actually. I hope anybody who's struggling with any disease, not just autoimmune disease, But any disease, I think there's always a way to turn that around.
Absolutely. I mean, that's why I started speaking about it as well, because like I said, uh, it's very lonely out there when you're going through something like this. And I just felt like if I can help, I'm not a doctor. I can only tell you about my journey. And not to say, even now, I have really bad days. It's not always good. It's not always happy. But that, sometimes in my mind, I just cross it. I said, okay, just let this day get over, and then we'll start afresh from tomorrow. So all of those things are there. And it's just... I think again, like movement, exercising helps so much, and then kind of everything falls into place. So when you were talking about healing, I did start on sort of the mental aspect of it a little before, but not as intense as it is now. So
It's a journey. It takes time. Like, so you
it
take
takes
one
time.
step, and then every day there's
Yeah.
something new that you're doing.
And I feel like people now, I mean, I guess it's a catch-22 situation because there's so much more awareness, but yet we see people getting more and more anxious and depressed.
Yeah. So this is what I believe. Like, this is what I see actually. Not just
Yeah.
believe. It's more of an observation that we are the most living in the most privileged time, yet we are the most depressed one.
Yeah, that's true.
Yeah, because the more we are understanding ke what is going on there, the more we are kind of like started to accept ke okay, ये हो गया हमारे साथ. Now we have to live with it.
Yeah.
The people who are in a depression, मुझे तो depression है, वो तो हो गया. They're not
And you use it as
overcoming
an
that.
excuse.
Yeah.
I did it. I'm telling you, like when I was like, okay, अब तो मैं हो गई मोटी and अब तो ये मेरी life है, but why should I do it? I've already gone through so much. I had medication, and so people are not going to be like, oh, Sahar, you ate so much. They were just like, oh, we get it. For you. So it's very easy to be stuck in that as well. And that's not good for you. It's not healthy. It's not good. So yeah, it's just
And changes are always very painful in the start. Like, I'm sure the first time you started training again, to create that habit, okay, I have to go to the gym 3 times a week. I have to do meditation. I have to take care of my mental health. I have to go and play sport. Starting with, it's a little difficult to get the hold of it. But I'm sure after some time, you kind of like start enjoying it.
So, Parvez, I've always believed that growth doesn't come if you're comfortable. Growth only comes when you throw yourself in uncomfortable situations. Uncomfortable meaning out of your normal routine and all of that, right? So, but also you have to be patient with yourself, and you also have to applaud yourself, and you have to give yourself a lot of credit. I think people forget to do that. But for example, with me, it didn't start everything at once. Like I came to the gym, and I remember after 8 months, you were like, okay, start your cardio now. So it was kind of a journey like that, and then I started enjoying it more. So for me, it wasn't overwhelming. Then I'm like, okay, what more can I do? What more can I fit here? So even Fridays now, sometimes I do come to the gym because I'm like, yaar, koi movement hi nahi hai aaj, so kuch to karna hai.
Okay, so anybody who's going through tough times right now with the autoimmune disease, what are the few steps you would like them to take that can help them? Not fixing the problem. We are not a medical expert, so we don't know how to fix any disease. But what few steps they can take which can help them in the road of recovery, I would say.
I think number one is your mindset, right? Like if you get an autoimmune and then you go think, oh, iska to koi cure hi nahi hai, and get depressed and all of that, that's really not going to help you. In fact, it's going to make it worse, So I think mindset is number one, that you have to believe in yourself, and you have to believe that you can lead a very normal life. I'm telling you, I'm doing it every day. And there's so many people I know, So that's number one. The second is, you have to see what your triggers are. Are your triggers based on stress? Are your triggers based on what you eat? Are you reacting to something that you eat? So if you have like a food diary, you can keep that, you can get like an allergy test done as well, and see, what suits you, what doesn't suit you, So all of these things you can do. And reach out to people. I mean, if you want, you can reach out to me as well. I can give more advice so that we can see which doctors to go to. Because over here as well, it's not that common to know कि अगर autoimmune होगा कौन से doctors, which ones are the good ones, So we can advise on that. In fact, maybe we should come out with a list कि कौन से doctors हैं. That would really help people. So all of those things, talk about it. connect with people, because now there are a lot of people. Connect with them, see their journey, what they went through. Talk about your symptoms, find the right doctors, look at what foods trigger you, look at what sort of stress may be triggering you as well, see what your energy levels are at. So all of those things are important, but I think mindset is number one.
Okay, so and right now, do you have any go-to doctor right now? If you have any flare-ups, so you can go to that person.
As of now, I'll be very, very honest with you. The person that I also went to, because I already got diagnosed, right? That's number one. So that was my own journey, which I'm not going to give the credit to any doctor for that, because really it was a process of elimination, and then asking someone in the US and literally going to a doctor and dermatologist and telling her, I think this might be it, and her just looking at it. And then, and the doctor that I go for my infusion, I literally go to him just for my infusion. So it's just for the treatment.
Okay, so it's
So,
it's a lot of your own work.
Yeah.
Yeah. So I think doctor needs to up their game right now.
They really
on
do,
this.
yeah. And I think I maybe need to go around and ask people and get a whole list, done. And for me, I personally don't like over medicating, and I think इधर कुछ है कि काफ़ी medicines देते हैं.
Yeah.
So
Yeah, even small flu antibiotic foreign say people are
exactly.
having like a.
I mean, right now I'm talking about health, but I've had the flu, but I'm avoiding the antibiotics. So वो अभी 2-3 हफ्ते ही चल गया है. So yeah.
Yeah. Okay. So one last question. So when you have autoimmune disease, you take immune suppressant, right? Do you have to keep your immune system low all the time, or will this ever be at a normal range ever?
So this is where I get confused as well, right? Because here I am taking all these supplements, and here I am trying to build my immunity. So I think it's always a good thing to build your immunity. No one will ever tell you, okay, no, don't do that. It's only when you have a flare-up they have to. That's the only way they know how to cure it. There is no special medicine for lupus, or there's no special medicine for diabetes, or maybe insulin, but no special medicine for pemphigus. They're kind of all the same medicines. Either we get steroids or we get a rituximab infusion. That's really it,
Yeah,
or you take immunosuppressants. So I think you just I would say always try to build your immunity, because
And you have and we don't know yet why your immune system start to attack your healthy cells. Is there any research that says, okay, this is why it happens, and this is why we get autoimmune disease?
that's the problem, na Parvez. They don't know why it happens, and that's why they don't know the cure.
Yeah.
If they knew why, they would have the cure, right? And there is no cure. If you look at any autoimmune, they'll always say there's no cure, but you can manage it and live with it. You can go into remission, right? But I also, like I said, I think it's a lot to do with stress. Now that we're reading about it, and especially when we were children, we didn't understand the trauma we went through. We didn't understand the gaslighting. We didn't understand a lot of the intergenerational marriages as well. We didn't understand a lot of things that go on right now, but our bodies have stored it, and I think it's now coming out. We have a better understanding of all of that. We have ways at least now to know how to manage stress, or also how important it is to draw your boundaries. I think that's number one when it comes to sort of stress, which is what I told you, like autoimmune. If you look around, a lot of times I'm telling you, like they always say, like the nice people get it. Not that I'm saying I'm very nice, but we're brought up in that way as well. Put your needs before everyone else's. What do you mean by self-love? Ye to ab cheezein aayi hai na, self-love and all of that. But it is very important.
Learn to say no.
Learn to say no. Yeah.
Sometimes we forget. Okay, this is something that we are never taught.
And you feel bad. Like even to date, sometimes when I say no, I'm like, oh, but what would the person think? And you're like, no, look after yourself. I'm not saying be that selfish, but say no when you have to. If you can't do it, if it's too much, if you're going to feel anxiety over it, if you're going to feel stress over it, then say no. That if it's good for you, So I think that's very important.
Yeah. So thank you so much, Sahar.
No, thank
It
you.
was really good talking to you because I got educated in a lot of stuff about autoimmune disease. I didn't know that, and thank you for sharing the story of like how muscle matter helped you in recovering. So, yeah, maybe if we get some questions, I'll have you back on the show.
Please,
And
please.
yeah,
Yeah, no, and thank you. I'm so glad, first of all, I mean, it's people like you who give it that importance that we can talk about it, you know. And then again, thank you for Muscle Matters for really, really changing my life. Every time I go anywhere, now, you know, everyone asks me what I'm doing, that I'm always give like Muscle Matters a credit, but it's much more than that, like I've spoken today
yeah,
about it.
yeah.
Yeah, so thank you.
Thank you so much. So.